Welcome, fellow practitioners, to Advanced Functional Therapy. The whole reason that I am making this page is because I want to help everyone, practitioners, therapists, doctors. I want to help the new people and the more senior people really expedite the healing process of your patients and your clients. For you newer practitioners, I want to help you advance your career forward more quickly, and I want to help you do that with less work, less physical stress on your body, less mental stress on your body. I want to help you really understand the patterns of how people work and how we get dysfunction, pain, disease, so that you can work with the client, with the patient, to help them heal, to help empower them to be able to create a sustainable health and a long-term health, and really keep them out of dysfunction and out of the clinic. As a practitioner, we want to help heal the patients. We want to help them recover and live a full, functional, optimal life. So to do so, we have to really look at the entire body, look at the entire life and lifestyle of the client or patient, to really help them recover quickly, to help them maintain that, and to help give them autonomy so they can understand their own body and their own health and how they work. So in today's video, I want to cover the overview of my philosophy of how I teach my students, how I work with my patients and my clients, and to kind of give you a understanding of how my brain works and how a lot of other practitioners' brain works, to really reverse engineer the human body, to figure out what is the root causation of their illness, dysfunction, disease, so that we can reverse that, we can help them heal, and we can help prevent future illness and disease and dysfunction. So that is the main goal of my philosophy and this channel. So first, I want to go over the focus of every session that I do with a patient. Every client or patient that comes into the clinic, comes into my treatment room, I'm looking at them, I'm assessing them, and looking at their body and seeing, is their body in anatomical position? Is their skeleton in this position? Okay, so my what I'm doing is looking at their patterns of dysfunction and seeing how can I restore those patterns that are of the joints that are not functional. How can I bring them back to normal joint function? So as we know, our body is, our body is consistent, it consists of bones, skeleton, to help us be erect in the world, to help house our organs, our nervous system, our brain, everything that we have. This is the foundation of what's going on, the base. And in order to move the skeleton and really keep it back into this position where it is innately supposed to be, we have, of course, a muscular system, okay, that works to move the joints, move the bones, as we all know. In between this system, we have a nervous system. We have a beautiful, long spinal structure that is meant to house our nervous system and to allow holes to innervate other parts of our body. So when we work in the world, when we move in the world, when we play in the world, our body gets put under stress, physical, chemical, or emotional stress, which too much of stress on the body either acute trauma or long-term chronic stress on the body is going to cause our body to adapt to the world. So if our muscles are moving in the world and they are adapting to the physical stress, this is going to, one, move the skeletal system, and two, it's going to possibly impinge on the nervous system, either in the spinal cord itself, the vertebra being displaced, or through the pelvic floor, or through the shoulder girdle. So there's different ways that the body is causing dysfunction, and the nervous system, as you know, controls everything in our body. This is our central processing unit. This controls everything in the body. So if something is wrong, let's look at the nervous system. And if something is wrong with a part of the nervous system, let's look at the structure, at the skeleton of the body, to figure out what is the root cause of this person's dysfunction, of this person's disease or imbalance. So this is what I'm looking at. This is what I mean when I'm going to reverse engineer the person to figure out what's going on. Because if the person is not in this anatomical position, then something in their life has caused too much physical stress, too much chemical stress, or too much emotional stress, or all three together, which is going to cause a imbalance in their structure, and then which is going to cause a dysfunction in their nervous system and in their muscular system. So I'm gonna assess them and look at them, and then I'm going to go to it's called the foundation assessment, where I'm taking in all the data of where do they work, what do they do physically throughout their day, what are they doing in their sleep, are they moving, are they not moving, what is their diet intake like, do they have any foods that could be causing more inflammation or irritation. So it's kind of like there's different questions that I'm going to ask them to really see the patterns of, based off what you're telling me, I'm noticing that the reason that you have this anterior rotation of the right shoulder and this hip hike of your left hip and your knee, and you have knee problems and foot problems, I can see based off the physical patterning and based off the questions and the assessment that I'm asking, what patterns that we can reverse to then restore anatomical position and restore the body's innate healing power, and giving it the environment to heal and to stay healthy. So in the next series of videos, I'm going to go through the foundation assessment, and we will go into detail of how I really look at each patient, how I break it down, and how you can use this assessment to reverse engineer and really get enough data so that you can build a plan out into the future to know exactly what to focus on to expedite their health and to get them to a place where they are in a environmental state to recover much more quickly, much faster, and you're doing less physical work on your end. Their body is doing less physical work that's going to cause more harm and damage in the long run. So we are working together with the body, with the human, to get the best outcome and get the best plan. So in the next series, we will break this foundation assessment down.